Several years ago when I used to practice law, I worked with this one particular county, or I had a lot of clients from one particular county who didn't have the ability to access health care. So I used to regularly refer them to the health department. And what I mean by the health department, the county health department. And to my surprise, there were some tough budgetary situations that popped up in that county. And one of the first things that went away was the services of providing health care under the health department. Now, let me be the first to tell you that if you don't have any money or you have no insurance, you never realize how powerful those things are until you find yourself in a situation where you have to access a health department. And in this particular instance, the one resource that I could direct individuals to assist them to get the medical treatment they had was no longer available to them. Now, we won't get into the whole discussion about the other things you could possibly do, whether it be share cost locations or maybe free clinics or even religious clinics where they help you out there. But I'm telling you this right now, as we move closer towards opening our economy and kind of letting the dust settle in terms of the economy, you're going to find there's going to be some tough decisions that are being made at all levels. So for those of you who are focusing on the federal level, I need you to also pay close attention to the state, county, and the city level when it comes to services and the social services that you receive. And you're probably gonna see some things that are gonna catch your attention. And it could be a variety of things. It could be downsizing, which means trying to do more with less. So that means the number of places that you have available to you may become less and less frequent. Privatization might be a possibility. In privatization, what you're doing is that sometimes what they do is the government will actually contract the services out to a private vendor to provide those services. I'm not saying private vendors don't do a great job. I'm just saying that you can sometimes notice a difference between the measure of treatment that you receive as a result of that. Also, elimination. There may be the decision that when in doubt, eliminating the situation or eliminating that service is in the best interest from a financial standpoint. You are in control of your circumstances. So I think it's really important that you do everything possible to find out how the current state of affairs is going to impact any social service program that you're taking advantage of. Contact them directly. Ask questions. Speak to, if it's a city facility, speak to your city representatives. If it's a county facility, ask your county representatives. Start engaging now to find out what you can do to ensure that those services are not negatively impacted as we start to come out and try to deal with the residuals of this pandemic and the effect it's had on our economy. Just saying.